Now, over the past few weeks, we have been talking about crime and violence as we come off of the heels of the recently held crime symposium. And this morning, we're continuing that discussion with criminologist Dr. Keron King. Dr. King, good morning. Thank you so much for joining us on Now.
Good morning, Kimberly, and good morning to your viewers.
Thank you so much for joining us this morning, Dr. King. I want to start off with your thoughts on what can be perceived as the increase in crime and violence that we're seeing in the country. I wanted to get your thoughts on that.
Well, like most of the citizens in Trinidad and Tobago, it continues to worry me both as a citizen, but also professionally as a criminologist. Trinidad and Tobago has been going through, I know we are talking about it now as a current uptick, especially when we think about home invasions and so on. But Trinidad and Tobago has been going through unprecedented rise in violent crime since about the mid-2000s. Unfortunately for us as a nation, every passing decade continues to be more violent than the others. And although we tend to talk about it in terms of current events and even annual figures, when we look at it from a more longitudinal or a longer breath, the sense that we get is that things aren't getting better, at least on the violent crime rate response. So I, like most citizens, am troubled. And you mentioned earlier about the regional symposium. I too look forward to the solutions and the agreements and hopefully better institutional structures that come out of that symposium. So hopefully, Kimberly, if we were to chat again in 10 years' time, the story would be different, you know?
Dr. King, well, let's go back. You mentioned a very important time period there, mid-2000s. Is it possible for us to pinpoint exactly what were some of the causes that we saw this increase started to occur?
Right. From a social scientific point of view, everyone has their sense of what might have played a part. So in the mid-2000s, we had, because you may remember, we first crossed the 500 murder toll in about 2008 or thereabout. My years could fail me, but it was somewhere around there. And there are a number of factors people offer. So one, at the point in time, people were talking about the 40s at the time. Other individuals made the point about the drug trade really taking a greater grip onto our society. And of course, as is the case today, the increase of the ways in which guns affected our society. So in many ways, 2000 for us from a violent crime rate point of view we can look at it as a starting point to discuss what we have tried. Because when we talk about the rise in crime in 2000, Kimberly, at the same time, commensurate with that, there was a lot of discussion around crime solutions. The older folks might remember Operation Anaconda, which was a law enforcement initiative. At the point in time, I recall, a couple of years before that, I recall the Center for Criminology at DWI putting forward some recommendations as well. So there were a lot of things happening in terms of solutions as well. And here we are almost, or more than really, almost 20 or a little over 20 years after. And we aren't the better for it. So that to me serves as a starting point for us to have a point about evaluation. Why is it, in spite of facing this problem for over 20 years or more, and in spite of the fact that we have made great investments with regards to all sorts of crime plans and crime strategies, we haven't achieved the goals that we, the public, and I imagine the policymakers want. To me, it leads naturally for us to consider a larger discussion on evaluation and the whole administration and management of the crime problem in our country.
Yeah. Well, Dr. King, it has been 20 years later, so let's look at some of those cures or those
Kimberly,
solutions.
I lost you there. I'm not hearing you.
Hello, Dr. King, can you hear me? Dr. King, hearing me now?
No. I lost you, or I lost audio.
One more time, Dr. King, can you hear me? Are you with me?
I'm hearing you very, very softly. I'm not making out anything you're saying.
Dr. King, can you hear me? Dr. King, anything on your end?
Loud and clear now.
Loud and clear now, good. So I was just asking, it has been 20 years later, and so I'm wondering, what can we do now? Let's look at some medium, some short-term, some long-term solutions to help us deal with this issue.
Kimberly, if you will allow me, I am an advocate for evidence-based criminal justice policy, like many of my colleagues. both in academia and in the public space. And I've been studying criminology for quite a while as a student and now as a professional.
Right.
And I have seen quite attractive and in some instances, theory-driven policies. But what I haven't seen is evaluation reports as to if those policies work. So let me give you a couple. In 2005, 2006, somewhere thereabout, the Trinidad and Tobago Police Service, in combination with the government of the day, implemented what is called policing for people.
Right.
One of the programs attached to that idea was something called a model station initiative. Kimberly, at the time, I was a master's student and very excited about this idea that we are going to have a model station initiative. It was well designed. It was based on good science. We had just forgive me for nerdying up the discussion a bit, but we had control groups and experimental groups in terms of the police station districts. Some of the early reports even showed that some of the goals that they sought to achieve, which was things like increasing public trust, working with the community, they achieved some of those goals. And
Right.
then, unbeknown to most of the public, this thing just came up the public space. We don't know if it is the police or the government were no longer happy with the approach or what happened. But we got a new commissioner and in 2010, and the thing just ended.
Mm.
So that was just one example. I could give you more. In 2002, we agreed as a country through the cabinet to have a restorative justice philosophy. We are over 21 years since that discussion, since that agreement, and one isn't sure the extent to which we have implemented restorative justice in the country, but more importantly, the extent to which we have evaluated the programs, if we have implemented any at all.
Yeah. Dr. King, in terms of the restorative justice, are you talking about the prison system? Because I know there's a restorative program going on right now in the prison system, but I can't agree if you're asking about where it is and in terms of evaluating it to see if it has benefits or, of course, disadvantages. But I believe there's something in the prison system. Is that the one you're referring to or something else?
I have two responses for you. Just like how you and I, we believe perhaps there may be something going on in the prison system as part of the problem. It ought not to be that we believe we might be sure. It should be we have clear documentation, whether virtually on our website or whether through reports laid at the parliament.
Yes.
But what I'm speaking about specifically is restorative justice is more than a prison program. One of the errors I think we made is we gave the prison the sole responsibility to implement restorative justice in the nation. What I am talking about is I'm talking about restorative justice as a philosophy to drive the justice system because it's a very attractive philosophy. The substantive argument behind the philosophy is that when crime happens, we interpret crime as a harm that was done unto the victim, and our activities must serve to restore the harm. Now, Kimberly, I am happy that in the children's court and through some of the work of the judiciary, I've seen some restorative justice programs, A Girl Like Me, Imani, and so on, are some of the programs.
Right.
And the judiciary, thankfully, has reported on some of the activities. But we have to implement the philosophy as a society, not just from the prison, but as a society, as a justice system. You know what I dream of, Kimberly? You were talking about solutions and short-term measures. You know what I dream of? That one day in Trinidad and Tobago, at every community-based center, we will have a restorative justice center. So when we have harms in the community, persons can go to the center so that their harms can be restored. This isn't a far-fetched thing. These are things people do in other jurisdictions. These are the things I believe, Kimberly, we have the resources to do. So we have many community centers. We could start with a pilot project, implement a restorative justice center. So when people go there, they can engage in different RJ practices and they can seek to restore the harm that has been done to them.
Yeah. Dr. King, one of the things that piqued, because I know that we're on the topic, of course, of crime and violence, but I was also wondering, is there any correlation between white-collar crime and what we're seeing now? Because we don't touch on white-collar crime a lot, but I don't know if there's some sort of correlation between that and the level of violence that we're seeing in this society.
Well, in terms of correlation, is an interesting term, right? And what I would have two responses. I have to be careful because there isn't any published research locally that makes such a connection between white collar crime and street crime or violent crime. So I want to make it clear that we don't have that local research to support that. However, a colleague of mine did some research on a concept called a relative deprivation, which is to say that when you compare your state of being compared to others, that you feel aggrieved, and sometimes you turn to antisocial behavior because of that relative deprivation when you compare your economic space in terms of other spaces.
Yeah.
Other wider research outside of the Caribbean have definitely made links between the ways in which corruption happens at institutional levels and the ways in which it impacts upon violent crime on the street. A colleague wrote a book that spoke about crimes of the streets and crimes in the streets, and they are indeed connected, right? Because the reality is, Kimberly, as the UN said in their SDG goals, strong justice institutions and strong societal institutions is linked to street crime. So if we have any kind of corruption happening at the level of institutions, which we commonly term white collar crime, that will definitely flow to the street crime, right? So definitely it's linked. And colleagues and myself probably need to do some more research in making that link. Because you're totally right. Oftentimes when we're talking about violent street crime, we often disconnect it from crimes in the streets. And we only tend to focus on crimes in the streets.
And my final question for you, Dr. King, do you think some people are predetermined to crime? And I use that phrase very, very wisely, and I use it because I know some people think about factors in terms of poverty and those who would have grown up in certain areas. They are often predisposed to these certain crimes and elements, and some people think that they are on that path to continue what they've been seeing in their communities. And so do you think some people are more vulnerable to crime and violence than others?
Yeah, I wouldn't use the word predetermined, primarily because criminology as a discipline, historically, that's where we started. We started as a discipline trying to make the point that maybe people are born criminal. So I want to stay away from the phrase because I know that's not what you mean.
Yes, exactly. Yeah.
I know that's not what you mean. But what I found in the research is that communities where people are more vulnerable, people are more underserved, people have more stresses, where they are what the sociologists call concentrated disadvantages in the communities. In those communities, the percentage of individuals who will turn to crime is high. So therefore, the solution is quite simple. We need to support. We need to ensure our interventions are meaningful to those who are underserved, those who are under-resourced, those who have a history of what we call concentrated disadvantages, which is to say, everything seems to be going wrong. We have social problems, economic problems, psychological problems, and we have to support these people. It's not enough simply to say, is low parenting or is poverty. It's not enough to say that. We have to support these individuals because they present a milieu or a social environment that suggests a significant percentage of them will turn, or rather will choose antisocial means to deal with their stresses. And it's the same we see in the medical field. If you have a particular social or biological environment that predisposes you or places you at a risk for engaging in a particular type of behavior, your doctor will tell you, cut back on the sugar. The doctor will tell you, ease off the salt, exercise more. That is really the public health approach in the sense that if we analyze this thing appropriately and we know people who come from particular communities, we know people who are under-resourced, we know people who have situations where they may have learning disabilities, we know people who have the situation, then we intervene early and we say we support them and we have that local research. We did a national youth survey almost, it's dated now, but we did a national youth survey that showed us the factors that lead people to make bad decisions. We need to reframe the discussion. It's not so much that a person is out on their own just committing a crime. It's larger than that. And that is the power of criminology.
Yes,
criminology
and Dr. King, we're going to have to put
factors
we're going to have to put a pin in here now, Dr. King. Dr. King, can you hear me? Dr. King, I'm
Oh, you were
so
speaking.
sorry to cut you
That's
up.
sorry, Kimberly.
Yeah, that's okay. That's fine. I'm so sorry to cut you, but we're going to have to put a pin in it for now. I thank you so much for everything that you've shared, and I hope that we can have you on again, because you definitely have a lot to say that I think everybody will want to be aware of. But let me thank you so much for your time this morning, and I hope that we could honestly take the tips that you have suggested into consideration. Thank you so much.
Thank you, Kimberly, for having
Have
me.
a good one.
Okay, you too.
And that was criminologist Dr. Keron King just giving us an update on some of the crime that we're seeing and the causes, and maybe how we can find some solutions to it. You're on the Now Morning Show. We're going to take a break and be right back. Stay with us.